Zollinger Ellison syndrome, a disease of GI system, also known as ZE syndrome. People who have ZE syndrome develop tumors known as gastrinomas in the pancreas and duodenum. So, to find out the mechanism of the syndrome, we have to understand the pathophysiology of this syndrome. So, let's get deep into this. As we know, there are certain specialized cells in our body which we call as enterochromophil-like cells, which are neuroendocrine in nature. It means they are able to produce certain hormones, mainly present in pancreas, stomach, and duodenum. So there might be a tumor originated from these cells, which is able to produce certain hormone, which is in this case is gastrin. So the gastrin directly stimulates the parietal cells and which leads to the excess production of acid in the stomach. As we know, whenever there is an increased production and secretion of acid in the stomach, the person might have a possibility to develop a peptic ulcer. Out of all cases, 50% of the patients might express a condition which we call as MEN1, multiple endocrine neoplasia. We can remember this clinical condition with 3 P's. The tumor can arise in GI tract along with pituitary and parathyroid gland, which are pancreas, pituitary, and parathyroid gland. So along with the peptic ulcer, patient might have excess parathyroid hormone release which lead to a condition of hypercalcemia. So now, clinical manifestation of the syndrome. Look at the signs and symptoms. Patient might complain of severe abdominal pain, diarrhea, along with that, nausea, malabsorption, malnourishment, and loss of appetite. And sometimes patient might complain of having blood in stool or dark stool. So these are the typical clinical manifestations by which patient might come to the clinic. So now, come to the diagnosis of the syndrome. Firstly, we have to check the serum gastrin level. Patient might have increased serum level of the gastrin. Secondly, we can perform endoscopy to find out the ulcer. Thirdly, we can perform abdominal CT to locate the tumor. And then we have a specific tumor marker known as chromogranin A. Once the diagnosis has been confirmed, then we have to come to the management of the syndrome. For the treatment, we should have 2 goals in front of us. Firstly, reduce the acid secretion, and secondly, removal of ulcer and tumor. For this, we can use proton pump inhibitors like omeprazole and lansoprazole. We can also use H2 blockers like famotidine and ranitidine. And for the removal of ulcer and tumor, we can use some surgical procedures. So up to now, we have ended up with introduction, pathophysiology, clinical manifestations, diagnosis, and the treatment. Now, if some of you have any question regarding this topic, you feel free to ask in the comment section.